Since the beginning of the COVID-19 pandemic, Oklahoma has been working on ways to keep ahead of viral outbreaks. And scientists are using an interesting way to monitor for those outbreaks. Taylor Jackson joins us to explain how it works. Taylor?
Jason, Oklahoma researchers can now predict surges in diseases, all thanks to wastewater. The chief operating officer at the Oklahoma City County Health Department, Phil Maytubby, says sewage surveillance and testing is useful to help better understand pathogens.
For example, we had a salmonella outbreak here about a month ago that was national. It would be nice to know, if we had the ability to test that so that we would be more prepared.
Dr. Katrin Kuhn is the infectious disease epidemiologist at the OU Hudson College of Public Health. She says one benefit of wastewater surveillance is that they don't need to wait for a human to develop the symptoms or go to the doctor for testing.
In the wastewater, we see the pathogens immediately. And for SARS-CoV-2 in Oklahoma City, we have seen lead times. That means early warning of between 7 and 10 days.
Kuhn explains the process for when a new variant is discovered.
When somebody discovers a new variant of any pathogen, there's a genetic code that belongs to that variant. And when you discover it, you send it out to the scientific community, who then has the genetic code, and they can start looking for it in the human samples or wastewater samples in our case.
Before, we were kind of flying blind with some of the viral outputs. We had to wait on human testing to kind of see what was going on. And, at best, we were 3 weeks behind.
Thanks to new technology, they are now able to get ahead of the curve. The team of researchers are able to track the number of cases and tell what strain is going around.
So when we first started this, we were dealing with the original strain of COVID. But as soon as we transitioned into Delta, they picked it up immediately.
Over the past few weeks, they've seen an increase in influenza as they test surveillance capabilities.
We've just started doing it this year, and there's not many people or not many teams around the world doing the same, so we're kind of inventing this new thing. What I would say for the time of year, we would expect influenza to start emerging now.
Maytubby says the flu is expected around this time of the year.
One of the things we do know now is that we start, the last few years we've started with the B types of flu. We are now have transitioned to A strains of flu. So that's going to either be an H3N2 or an H1N1 strain.
This knowledge gives the ability to see how hospitals will be affected given the unpredictability of COVID-19, even as flu season starts. Increased flu patients going into the hospital can put pressure on the system as they take care of an increased number of COVID patients. In January 2021, the highest number of hospitalizations was 1,823 and went down in June to 121. President of the Oklahoma Hospital Association, Patty Davis, says when numbers ramped up again in August, staffing became a problem once again.
The second surge was 1,554 patients. This was probably even more difficult because we had less staffed beds to cope with the COVID numbers at that time.
If I can tell you that next week our flu rates are going to be higher and that we're going to ask people to try to go out and get vaccinated for their own protection, it will have a lot more meaning than it would just saying it by itself.
The wastewater surveillance helps to make the public more aware of possible breakouts sooner.
We're at OU today. We're part of a bigger system, which is our whole public health system, which is all the hospitals, public health, all the practitioners. So we all work together. We all message and try to get the information out to the general public so that they understand what's going on.
Within a few more weeks, the Oklahoma research team will be able to tabulate results from the collected data.
We can quantify the concentrations of influenza that we're measuring in the wastewater, and when we have a few more weeks of data, we'll actually be able to associate these measures of viral load in the wastewater with actual reported cases.
And assist with predicting expected cases in the near future. During the fall and winter, we see multiple respiratory diseases outbreaks such as COVID and RSV. Maytubby says the main issue after analyzing the data is figuring out if the medical system can handle all potential viruses at one time. Experts say that with the holiday quickly approaching, vaccinations for both COVID and influenza should be considered. With over 500 providers in Oklahoma County offering the COVID-19 vaccines, more than 1 million doses have been administered.
I think that when we get the combination of a reasonable public health response combined with the availability of the monoclonal antibodies, the availability of vaccines with appropriate boosters, and then a medication to actually treat people who get the virus, and whether they're vaccinated or not, I think is going to make a really big difference.
Once researchers finish analyzing all of the influenza data, the information will then be released to the public.